Hi, I'm Dr. Rahman, and welcome to Black Women's Health, where we hear stories about Black women achieving each and every day in spite of the odds. Our guest has an interesting story which was informed by what she witnessed at a very early age. Have a listen.
My name is Rosalind Young Daniels, and I'm president and founder of Black Health Matters.
Excellent. Now, I'm also told that there's a story that leads to the formation of Black Health Matters. Am I correct?
Yes, yes, there is.
Well,
So,
yes, please share.
okay. So, it's not it's so commonplace. But the impetus was that I lost my grandparents too soon. I love them. I was the apple of their eye, vice versa. And we just had an amazing, loving, kind, wonderful relationship.
Mm-hmm.
And my grandparents both died too soon. So literally, my grandmother went to the hospital and probably died like 3 or 4 days later from the time of admission to the time of her demise, which meant that she was living in fear, that she was living in pain, that she was felt incredibly isolated. I say that because as much as we loved her and as often as we saw her, she never shared that she was going through anything. She did not share it with the friends that she had, and really didn't even share it with her spouse. So
Mm.
she took on all of that, which we know the burden of that is just unbearable. Took all that on her own, and then why, obviously the going to see a doctor, getting medical treatment was the last resort. Why is it that someone who's suffering going to a doctor is the last resort? I just couldn't fathom that.
True.
So um when I was in the hospital with her during her last hours, I saw, the level of pain. And she was totally did not know I was there or anything like that. And I saw, my parents were kind of, in the hall. They were crying, they were really upset because, she was a beloved member of our family. But I was kind of angry. And it's like, well, how, and again, when you're a teenager, I was probably 17. How did it get to this, and why? And why are you not, uh, do it? Why are you not Why are you not shaking trees? Why are you not, stomping up and down the hall? Whatever young people think is a great sign of activism. I was like, well, why are you all not doing any of that?
Mm-hmm.
And I understood. And again, my parents are educated, not that you have to be educated to be an advocate, but they had some facility to be able to communicate. So why is it that with the skills and the life experiences that they had, that they could not do anything to support my grandmother? And I came to the realization years later, after thinking about this, is that probably just because they didn't know what to say, they didn't know who to say it to. Uh, they just didn't have the skills to really help her. And I think what Maya Angelou says is so true. When you know better, you do
Do
better.
better. Yeah.
And so that just stuck with me. So when um, the passage of direct to consumer advertising became a reality, meaning that pharma was able to start to advertise their therapies to patients and caregivers and just the American public, I thought that's kind of good. There could be it could help people think that they could schedule an appointment and possibly be seen, or that, because in the dark ages, which means before patient physician dialogue was heralded as something that is helpful, this was all before that.
Mm-hmm.
Before DTC, which is probably like in the 2000s, doctors were almost godlike. They made decisions you didn't question, you didn't ask for other kinds of reference points. And so this would kind of break it up a little bit. So I thought direct to consumer was helpful because you had a magazine ad that you could take in and say, what about this? And that doctor would have to kind of explain and give you an answer. And it would help you to be a little more proactive. So now here we are, almost 20 something years later. And so that was the first milestone that helped me to see that there could be some learning and some education going on. But
Can
then,
I
and
can
I'm
I
sorry, go
stop?
ahead.
Can I
Yes.
stop? I want to dig a little bit deeper into your story about how old was your grandmother when she was admitted to the hospital?
Faceted, great question. So she must have been about 73, 74.
And it's your understanding that she did not go to the doctors on a regular basis?
Absolutely did not.
And so by the time she finally went to the hospital, whatever was going on was at its end stage.
Correct.
I sense some disappointment and anger when you tell the story. So I guess my question is, who is that being directed at?
That's a great question. It's being directed at society. It's
Okay.
being directed at the medical establishment that for so many, and my story is not unusual.
Unique. That's right. A
It's
lot
just
of people feel this way. Absolutely.
And we're talking about the 70s. Can you imagine? People feel that way today. So this was in the 70s when she passed. So we didn't have the facility. We weren't, and again, Black Health Matters. Now we talk about, we radicalize people. Unfortunately, now in 2023, the notion that we're going to be healthy and get second opinions and all that is still kind of radical and new. But back in the 70s, oh my gosh, it was pretty much a wrap.
Right.
We Because I saw a lot of what was at play. Her zip code would not be considered desirable. So the
Mhm,
social determinants of health
mhm,
weighed heavily on the
mhm.
fact that she did not pull through, that her health was poor. She lived in a food desert.
Yes.
I
Yes.
lived in the suburbs, but when I went to see her and we would go shopping in her supermarkets, I was just appalled. And again, you don't have to be an advocate, you don't have to be an activist. You could see the difference between
Absolutely.
what happens in the suburbs versus happens in the inner city. So
And
there were just I'm sorry.
so no, continue. I have another question for you though.
No, but there were just so many other predetermined factors as to why she wasn't going to make it. But so yes, the anger is at the system.
So this is my follow-up question. Was it because, and it may be both, was it because your grandmother didn't have access to care, or your grandmother didn't trust the care she had access to?
Those are great questions. I would have to say didn't have access to care. It was not a priority. I'm sure she went years without seeing a physician.
Hmm.
Whereas now that's one of the first things we probably ask all of our loved ones, right? When's the last time you've seen a doctor? What did the doctor say?
Right,
How did you get your checkup? So that's in our vernacular now.
right.
Um,
So,
so yeah,
so it was your grandmother did not have access to care.
didn't have access to care. Right. More didn't have access to care than I think anything else.
Okay. It's kind of hard to speak for your grandmother, but do you think she wanted that type of care? Because a lot uh, of us prefer to go herbal or do other treatments. But pretty much when you're talking about allopathic medicine, it's either going to be a medication or a surgery.
Hmm.
And a lot of us don't like taking medications, and if I think all of us would love to avoid surgery if possible.
So true. I just can't. I was so young, I can't speak to that, but I think everyone wants to live.
Absolutely. Absolutely. But what's clear is that it didn't seem right. Whatever the reasons, it just didn't seem right to you at that tender age of 17.
Correct.
And
Something went wrong.
something was wrong. Something was wrong. And you were able to tap into and tune into that.
Right. Why is it that the medical system could literally not, and when it doesn't work, people die. There's a direct relationship,
Mhm,
especially in those days.
mhm.
You don't get a hall pass. There's no luck there. So if you did not have preventative care or anything like that,
Mhm.
based on the time and again, the social determinants of health, it was a death sentence. And then the rest, and then the other relatives, they all kind of died around the same time.
Oh, okay. So huge problem, probably not one answer, but what's your approach been to address this?
Was launching Black Health Matters,
Mhm.
um, which I did because of the passage of the Affordable Care Act.
Mm,
So I was hopeful and optimistic, and also to some degree naive. But with the passage of the Affordable Care Act, I was excited because people would have access.
mm,
So for the mom who has to decide between groceries and a mammogram, she
yes.
can do both. Certain
Yeah.
things would just be undeniable. You would have some of these screenings that would be helpful.
Yeah.
And it would be based on what your ability is to pay. So I thought, well, this is the time to really build a health and institution around health and wellness, because access is key. And so we understood that people wouldn't run out right away and understand. So we decided that we would become the North Star for thousands of Black folks and people of color who would start to embark upon a health journey to improve their health and that of their families. So we knew we were in it for the long term,
Hmm.
just had no idea that it would take so much time. But it's
Explain
better
it to
to
me.
start. I'm
Explain it
sorry.
to me. Explain it to me a little bit more. So, with the Affordable Care Act, where there were some services which no longer required me to pay, i.e., a mammogram, what what did your organization do or facilitate?
So we started out as a website because knowledge is power.
Yes.
And I thought back to the times when people of color, Black folks in this country, were enslaved. One of the first things we did when we had our freedom was we built schools. And then we built historically Black institutions
Hmm.
to a great degree. So think about it. We were just so proud and wanted people to do well through education. So that was my thinking about. It was in that spirit that I created Black Health Matters, the website.
Okay, to
So
make people aware, to
yes,
make people aware that these services were available to them.
right, and
Uh,
have people in culture. So I
mhm.
grew up at a time when people used to marvel at Essence magazine because it was the only publication that celebrated the beauty and the lifestyle and the culture of Black women. And unfortunately, Essence had the job to get you from the cradle to the grave. So they had to speak to the full span of Black women and over time, um, through the course of their lives, through multiple touch points. And so I felt that if I had something that was health related, that was self reflective, people could
Right,
see themselves. They
right.
could understand diet and nutrition through the lens of we're coming from soul food. Let's think about greens in another way. Let's think about kale in another way. So, uh, being able to kind of synthesize all of those cultural nuances into a platform that would say some of these things are great and some of these things need to be modified, but we can be healthy. So putting that lifeline out there was the goal of launching Black Health Matters. And we launched to improve health literacy. And then we grew to have other tentacles.
Wow, that sounds phenomenal. How long has it been in existence?
11 years.
Wow, wow. And do you feel that your original thoughts about just making the information available has had the impact that you expected? I'm not saying that there was an overnight change, but your original thoughts have been validated, that when people have information, they do better.
Yes. But now, so there's kind of the naivete. Let's build it and they will come. That was not the case. So I launched Black Health Matters 1 year prior to the Black Lives Matter movement. And so, first it was the website, and it took a while for it to catch on. So I tell the stories that in terms of building awareness for the website, most publishers work with Facebook. And I would start to put stories into Facebook and say, and one of the popular groups on Facebook it's all about natural hair and Black women and their hair. And I would slip in an article, wow, if you guys are interested in great healthy hair, well, then you have to take care of your heart and eat healthy foods and work out, and your vascular system will pump up and you'll have healthier hair. And so it was a stretch, but we were trying to get eyeballs. And so those groups literally would report us to the Facebook gods, and we would be shut down for weeks at a time, unable to post any content.
Interesting.
Isn't that fascinating? But here we are now in 2023. I'm happy to say we can go into just about any Facebook chat group that we want to, with the appropriate messaging, of course.
Yes.
But we're able to go into almost any group that we want. So the awareness is now there.
Okay. So, I mean, that's interesting on so many levels, because you were putting the information out there, but initially it wasn't seen as positive.
It was there. I don't think there was any reaction whatsoever. It's like, I don't know if I could say positive, because that's more of a value judgment, but it was just, it was what it was. In other words,
okay, we can say it wasn't germane to the topic. It wasn't about hair specifically.
Right.
And that was the problem initially, or that was seen as the problem initially.
Or that the health hair connection, they didn't, it just didn't seem anywhere close to the topic.
Interesting. Okay.
Even though we were trying to get that heart health message in there. And,
even though there clearly is a connection.
Right.
But it wasn't appreciated.
Right.
Interesting.
Okay. But the fact that 1 in 3, 1 in 4 Black women will have heart disease, I mean, that's still something pretty serious.
That's right. I mean, we worry about breast cancer in general, but the reality is the majority of us will die from cardiovascular disease.
Amen.
And a lot of it is preventable.
Yes.
And it has to do, just as you were referring to, having the information, having the information and being able to incorporate it into your life, in your lifestyle.
Right.
Well, fascinating. So now, where are your sites, and how do people find you, and what else are you offering?
So we are, again, www.blackhealthmatters.com. And then, one of the things that was interesting along our journey, and we do a lot of work in clinical trials, is that we partnered with, various organizations. And that's how I first became aware of Bristol Myers Squibb, because they seem to be very genuine in terms of their interest in health equity. And so I was so delighted last year when they asked me to participate in their signature program called Survivorship Today.
Hmm.
And that gave me an opportunity to sit and have a conversation with other cancer survivors and what it's like to be a strong Black woman being dealt the blow of having to manage a cancer diagnosis. And of course, that was fascinating, but it gave me an opportunity to network and speak with other women as well as a health advocate on, what happens when you're diagnosed and how do you pull strength and do you tell your family and how important is faith and what do you say to your kids? What happens if it's rare? If you have breast cancer, you can pray to have, some of the cancers that are so prominent that people know right away, kind of like there are 4 courses of treatment. You'll get, and or instead thinking about what happens when you have a rare cancer. So that was a really illuminating experience.
And that was your personal journey?
It was my personal journey. It's interesting because, I was just sharing notes with some members of my team. Obviously I made it to the other side and I'm happy to do that. But having the avocation of being a publisher of a health website, Black Health Matters, really helped save my life. I followed the advice that I was writing about. I was minimizing my risk factors. I was eating a great diet. I was working out at least 4 times a week. I managed my stress, all of that. So when I was
How
diagnosed, I'm sorry.
interesting. No, no, I'm saying how interesting. I guess I didn't appreciate that you had already established Black Health Matters when you received your diagnosis.
Yes,
And you were doing all the right things
right.
when you
Exactly.
got your diagnosis.
Exactly.
And that's a very interesting position to be in because we always assume if only you have been eating better or exercising or managing your stress, this wouldn't have happened.
Let me tell you this, and I'm not just saying, I mean, it literally, because of it helped save my life because I had the sense enough to get a second opinion.
Mm.
I had the sense enough to know that something was wrong and I needed to take action. I had to know, and I was, again, sharing with friends, and as we discussed on, Survivorship Today, that I was healthy enough to withstand the
Oh, good
surgery,
point.
like an
Good point.
8-hour surgery.
Good point. Good point.
So when something happens, your body, you need to be healthy enough, and things happen, and it could be genetics. It's not your fault. We're not pointing fingers. We're not trying to stigmatize chronic conditions at all. But if something happens, you need to be able to have, your body needs to be strong enough to fight. So just like we were speaking about heart disease, if I had, high blood pressure, or if I had, cholesterol, or if I had kidney disease or other comorbidities, it would have made it that much difficult for me to get to the other side of this cancer diagnosis.
And I'm assuming that you were in tune with your body enough to know when something wasn't right.
Exactly. Not only just to be in, but did something about it.
Yeah.
Didn't wish that it would go away, but
Yeah.
was like, I got to figure this out.
That's good. That's a good point. That's a good point. Um, so it's worth being healthy and taking care of yourself for a number to prevent and also to be aware
Yes. And to do battle.
and to do that.
Again, as I moderated the Survivorship Today panel called In Her Shoes, Life as a Black Woman Cancer Survivor, one of the things we talk about is, again, drawing strength and being able to be vulnerable for the first time in my life. And the other panelists did as well. Here I am, running a business. I have been a single parent, all of those wonderful things. But then all of a sudden having to be the vulnerable one in the family.
Yeah.
It was very different.
Yeah. So, did you feel differently with your grandmother? Um, there was, frustration and disappointment, and maybe even some anger about how things evolved. When it was your experience, did you have similar feelings, or did you feel that um, healthcare? I mean, so with your grandmother, it was, we thought, primarily she didn't have access to care. With you, not so much in terms of access to care, but did you feel that you received good care?
Because I work in this industry and my lifestyle is that to be an entrepreneur, to work in, a space such as health, before people really understood that healthcare and health, that we could become healthy was important. I just had this drive that I was going to get the best care possible. And I was going to make phone calls. I was going to
Mm,
make sure, bug my insurance. I
mm,
was literally on a mission to save my life.
mhm.
And I just could, I just had to focus on one thing, and I got that. But to your point, doctor, I mean, when I had my diagnosis, my physician look when she was looking, she's like, you just don't seem like a woman who has, stage 3 ovarian cancer. I mean, and then she called other people in to look at me. It's like, you just don't look sick. But of course, we did all the tests, and I was, I guess to give you an example, what is it? Your A13,
CA
um,
25.
your A20, right? It should have been what, 10 or 15. It was like in the thousands. So there was no question that I had cancer. But again, because my lifestyle, and I guess genes, genetics, and the Lord made it so I was still functioning. I was, probably before the cancer diagnosis, I probably ran a mile that morning before I went to the doctor's office. So,
Right.
but all of that helped, that I think helped push me to the other side.
Wow. What a story. So, what would you want? So, I should back up and tell you that this podcast was started because when we hear about the statistics about Black women and Black women's health, it always tends to be dismal. And I was afraid that we become apathetic. Why should I even try? The odds are always stacked against me. And so when I created the podcast, it was, we want to talk about health, but we want to talk about it and give it a different emphasis with women who are achieving, surviving, excelling, just being badasses about it. And so, and you truly exemplify that. So, what would you tell other Black women? What message would you like to leave for them?
As I learned from moderating that panel with Survivorship Today, um, which is survivorshiptoday.com for others who would like to see, that many Black women are inclined to take care of the needs of others first, which can lead their own health to taking a back seat. And that was also one of the conversations we had with Survivorship Today. Um, that we have to, again, understand that being vulnerable is a part of that comes with it. You'll see other women who provided testimonials about what it was like to have to care for children when they were diagnosed from cancer, and and then our health equity person, our patient navigator, would talk about it's not uncommon for us to feel sad and for us to be depressed, and we need to also embrace all of that and not to be hard on ourselves, because it's a very difficult time when you've had that diagnosis.
Absolutely. Absolutely. And if women wanted to reach you or learn more about your website or your organization, how would they do that?
They can definitely email me at Roslyn, Roslyn, at blackhealthmatters.com. And if they would like to see this inspiring conversation amongst other cancer survivors that are Black women who are really just amazing individuals, they should go to survivorshiptoday.com.
Okay. Well, thank you. Thank you for the work that you're doing. I think your experience has made you an even stronger advocate for health, particularly Black women's health.
What do they say, Doctor? Everyone needs a testimonial.
Everyone has a story. That is true.
Right. Everyone needs that testimonial. Everyone has the story. And I feel that that was kind of divine, that I can really speak to the patient experience